Hey, good afternoon, everyone. My name is Lisa Smith. Welcome to our speakers. I wanted to just begin by saying thank you for taking the time this afternoon to talk about healthcare coverage resources for people in the Washington state, but for our purposes today, we're really focused on healthcare coverage opportunities for small businesses, and then later more specifically about healthcare coverage for childcare workers. As I mentioned, my name is Lisa Smith. I'm with the Washington State Microenterprise Association, and our work is really supporting very small businesses around Washington, very small organizations around Washington State that serve small businesses. And you can go to our website and check out the many organizations that do this important work. Our role is to help capacity building for these organizations, training and technical assistance, which is what this is a part, resource coordination, and then we also offer very small grants to these nonprofits to better equip the businesses they serve with training, technical assistance, microloans, and other resources. We also do a lot of networking. And so I'm really grateful today because we know that many businesses suffer because they don't have the health coverage they need for themselves or their employees. And we also know that there's a crisis in childcare in Washington State. And so today what we're going to do is have a couple of experts. We're really excited to have McHale and Joan Altman join us. Joan is the Director of Government Affairs and Strategic Partnerships with the Washington Health Benefit Exchange. And then McHale is the Associate Director, Outreach, and also with the Washington Health Benefit Exchange. Later on, we'll have María Rodríguez. She's the Executive Director of the Rural Community Development Resources, to kind of share the perspective or insight from one of our microenterprise development organizations and the work they do in helping childcare centers and home daycare centers navigate all that is really needed to be effective as a small business and support their workers. So I wanted to say, if you can go back to that slide, I wanted to begin with some statistics that came out of the Department of Commerce this afternoon, and just how profound of a crisis we have with childcare. It's urgent right now as kids are going back to school and parents are struggling to try to figure out how to stay at work and get to work. 47% of unemployed parents report a lack of childcare options, and they're a huge barrier for reemployment. 63% of children live where there isn't enough childcare. So that's 63% don't have childcare nearby. And of course, the cost for licensed childcare can range between 35 and 155% of a family's income, which is like private school for some people. And then some data about childcare providers, 43% annual employee turnover. Now, we know there's a lot of reasons why there's turnover, but one very critical reason is the lack of healthcare coverage. Another statistic is the lowest earning of any college major is for childcare workers. So childcare income is very low, and it's a barrier for so many people, so many childcare centers. And then finally, 17% decline in home-based childcare services. And so here's what we know. We know home childcare centers can create livable livelihoods or income for limited income entrepreneurs. They need to get licensed. They need to have microloans to help get all the equipment for their childcare, home daycare centers. But once they do, and they can charge what they need to be a profitable home daycare, it's actually a good livelihood. And so creating the environment for more of these small businesses to start and to grow is critical to what we want to accomplish. So there's some data, but I'd like to begin now to just invite Mary and Joan to introduce yourselves. I know you're just the brief conversations I've had, you're incredibly knowledgeable and helpful in this area. So introduce yourselves, your organization, and what you're going to be covering today.
Absolutely. Thank you so much for having us, Lisa. My name is María, McHale. My pronouns are they and them. And let me know if you have questions about those pronouns or how to use them. I'm the Associate Director of Outreach at the Washington State Health Benefit Exchange. And I'm excited to talk to you today about what we do at the exchange, the services that we offer. And then Joan's going to introduce herself, and she's going to go a little bit deeper into a new program we are launching for childcare workers. So Joan, do you want to do a quick intro before I launch into it?
Sure. Can you all hear me?
Yes.
Oh, great. I'm Joan Altman. I'm the Director of Government Affairs and Strategic Partnerships at the Exchange. Really excited to talk to you about a new initiative that the legislature passed this past session. Lisa, I really appreciate the welcome and the opportunity to speak with you all today. We have heard over and over again, the intersection of healthcare and childcare is a really critical one. We know not only are there people who have a lack of childcare as a barrier to sort of reentry into the workforce, we also know that when childcare providers themselves are not healthy, it's a barrier for several other work sectors in getting their jobs done who are reliant on high quality childcare, like our healthcare providers and our public health officials and everyone who around the state who's working hard to sort of address the pandemic. So lots of intersecting social determinants of health happening at one time, and really excited we could sort of launch this partnership, and hopefully it's one that continues well into open enrollment this year.
Wonderful. And I just want to say we've had so many people reach out to us saying they can't attend today in person, but they really want to watch this webinar afterward. And so this will be put together with the chat summary and will be out either by tomorrow or Monday. So those who couldn't attend today can participate in the future. So without further ado, Maria will be joining us around 2:30. Why don't you begin your presentations?
That sounds good. All right, Joan, next slide, please. All right, so I'm going to step through just the basics of what the Washington Health Benefit Exchange is, what we do, the Washington Health Plan Finder, and I want to stress that I'm about to give you a lot of information. These slides will be sent out afterwards. We know that health coverage and healthcare and accessing these things can be really overwhelming for folks. So as I'm stepping through all the information I'm about to give you, once you start feeling overwhelmed, just remind yourself that there's a lot of help out there to help you use our website. And if you have questions as we go, please put them in the chat box. I've got the chat box open on one of my monitors. I'll keep an eye on it, but Joan and Lisa keep an eye on it as well, and we can just field questions as we go. All right, so the Washington State Health Benefit Exchange, we run the Washington Health Plan Finder, and that's WA Healthplanfinder.org. And once you go to the Health Plan Finder, you can do two things there. You can, one, sign up for free or low cost health coverage, and that's Washington Apple Health, or that's what we call Medicaid in Washington State. And that has some income qualifications. And if you don't qualify for free or low cost coverage through Washington Apple Health, that's where you have the option of purchasing a qualified health plan and a qualified dental plan. And these are essentially private insurance coverage. And so our website is the only place where you can access federal financial assistance to help make that private coverage more affordable. So I'm going to step through some of these options today, help you understand what the process is to use our website. How can you connect with some assisters to make the process a little bit easier? But again, throw those questions in the chat box and we will take them as we go. All right, next slide, please. So one question we get right up front from folks is, when can I sign up for coverage on the Health Plan Finder? So that depends on what coverage option you are looking at. So for Washington Apple Health or Medicaid, that enrollment is available year round. So at any point in the year, you can go to wahealthplanfinder.org, fill out the application, and if you qualify for Apple Health, you'll get automatically enrolled. For qualified health plans and qualified dental plans, it's a little bit more nuanced, but there are some standard times throughout the year when you can enroll. For instance, during fall, we have our open enrollment period. That's every November 1st. This year, it goes through January 15th. And if you go to the Health Plan Finder between those dates, you can purchase a qualified health plan and qualified dental plan that will cover you for all of 2022. And outside of open enrollment, we do have a couple of other ways that folks can sign up for qualified health plans and qualified dental plans, even if it's outside of open enrollment. So you might experience what we call a qualifying life event. That could be if you lose your employer coverage, if you have a change in your household income, if you have a change in your household size. And typically you have 60 days from the date of that qualifying event to go on to the Health Plan Finder, fill out the application, and purchase a qualified health plan or a qualified dental plan. And then aside from that, sometimes, like we've seen throughout the pandemic, we do have other designated special enrollment periods. Like we've seen with the COVID pandemic, we opened up a special enrollment period both last year and this year, just to allow folks some extra opportunities to get that health insurance coverage, especially at a time like now, when I think a lot of folks who were previously uninsured are really understanding why they might need that health coverage these days. Next slide, please. Another common question, how much does coverage cost? And again, it's really going to depend on a lot of factors, but for the most part, Washington Apple Health or Medicaid is free or low cost. And we're going to go into a little bit more detail on some slides that are coming up. And then for qualified health plans and qualified dental plans, prices really vary a lot depending on age, your household income, where you live in the state. But I always tell folks, don't make assumptions about what may or may not be affordable until you come onto our website, fill out the application, and really get a better understanding of what federal subsidies might be available to you to help offset that cost. And our website can help you calculate what help you might qualify for to lower your premiums and those out-of-pocket costs. So I always say, folks, again, please don't make assumptions saying, oh, private health coverage, I know I don't qualify for Medicaid. Please don't assume that private health coverage or purchasing a qualified health plan is going to be unaffordable, because we do have a lot of options to help reduce that monthly cost. And I see a question in the chat. Do business owners, entrepreneurs have any additional steps they need to take to sign up? Do you know what percentage of enrollees are entrepreneurs? Nope, that's a very interesting question though, Lisa. I don't know that we know what percentage are entrepreneurs. And in terms of additional steps to sign up, we're going to talk a little bit in a couple of slides about how to connect with a trained assister who can help people use the Health Plan Finder, because especially for small business owners, there's some additional deductions that can lower your taxable income that folks might not know to enter. And so working with a trained assister can really help, especially small business owners, use our website in the best way to get all of the savings that they might qualify for. Next slide, please. Oh, Joan, you want to hop on?
Well, I'll just say, Mary, while I'm advancing this slide, that we know from sort of the work that we've done in working in partnership with community that there are a number of self-employed individuals who use the exchange. I think there's some particular deductions that people qualify for who are self-employed, and we know from working with our customers and from feedback we get from our on-the-ground assister network that we have about 200,000, 250,000 folks in the exchange. We also know lobbyists who are self-employed who use the exchange just from our personal roles. So we know that there are several sort of small businesses to the extent that they're self-employed folks in the exchange. And we know that there are some people who maybe have a small business, one or two people who work for them, who are also using the exchange through working with brokers and some of our other Navigator partners. So we don't have an exact number for you. When you come into Health Plan Finder, you enter your employment income and you enter your employer. And so we have some general information about where people are employed, but we don't ask specifically by size or by sector of employment.
Yeah, thanks so much, Joan.
Sure.
All right, we're going to go into Apple Health coverage just a little bit deeper, and then we're going to talk about qualified health plans. So for Apple Health coverage, how you sign up, you go to the Washington Health Plan Finder, that's WA Healthplanfinder.org. And these programs are administered by the Healthcare Authority, which is our state's Medicaid agency. And there's a link on this slide. These slides are going to be sent out afterwards, so you can feel free to go to that link to learn more. I'm not going to go over it in detail, but this slide also has the income eligibility chart. So at a quick glance, you can look and see what you think you might qualify for in terms of Apple Health coverage. But just want to flag that there are active links on this slide that I encourage folks to use afterwards to go get some more detailed information about Apple Health eligibility requirements. Next slide, please. And for qualified health plans, in terms of signing up, it's the same process, same website, wahealthplanfinder.org. And we know that comparing private health insurance plans can be really confusing for folks. And so we do have a number of tools available on our website to help folks compare specific plans in their area. We'll talk a little bit more about that in a second. It's called the Smart Plan Finder, but just wanted to flag for folks up front that There are tools available to help. We also have some good information on our website. So if health insurance coverage is something that you feel like you know a little bit about, but you want to beef up your knowledge base, check out our website. We do have some information such as the coverage basics, which you see linked here. It just gives some good information as folks are thinking about what coverage options might be best for them. Next slide, please.
And Mary, I'll add one more thing on this slide, which is the amounts that you see here are listed under the premium tax credits, the sort of 50,000 a year up to 85,000 a year for a family of 3. I'll just let you know that before this year, that was sort of the income threshold for where you could get subsidies to lower your premium amount through the exchange. With the COVID pandemic and with the American Rescue Plan, we now have an ability to be providing financial assistance to people well above those amounts. So the cap used to be 400% of the federal poverty level. Now there are people at 600%, at 700%, at 800% who, depending on your age, can be getting some pretty significant assistance. People over these listed amounts are seeing $200, $300 worth of tax credits come their way since this past year when we implemented the American Rescue Plan subsidies. So Mary will speak more about that in a minute, but just want to let people know when we say premium tax credits are available to people making up to and over these amounts, we really mean over. So if there's any sort of takeaway from today, it's that really, to Mary's earlier point, like you are someone who can be making $50,000 a year, $60,000 a year, $70,000, well up into those income brackets, particularly if you are someone who has a family and be receiving financial assistance.
Yep.
So underscoring that point for everyone. Mary, sorry, back to you.
Yeah, no worries. So another question we get, how do federal subsidies actually help to lower my costs? And I really like this slide. I love the graphic that's on it. So, premium tax credits are income-based tax credits that help offset how much you pay for your monthly premium. So if you look at the slide here, so if your premium cost is going to be $300 a month, but you qualify for $100 in tax credits, that's going to make your overall monthly payment only $200. And so that's just one example of how a tax credit can help lower your overall premium cost. But definitely go to the website, fill out the application. $100 is just a figure that we're using here, but certainly don't take that as the benchmark because, as Joan said, right now there are really generous subsidies that are available. We've always had premium tax credits available to folks, but earlier this year, the federal government passed the American Rescue Plan Act, or as we affectionately call it, ARPA, and that provided even more subsidies on top of what was currently available and extended the eligibility income guidelines for folks who could qualify for them. So folks who were already getting subsidies are now getting more, and folks who never qualified for them before, as of this spring, now qualify for tax credits. So again, as Joan already said, as I said, don't make assumptions about what you think you might qualify for. It really is just in your best interest and in your employee's best interest to go to WA Healthplanfinder.org, fill out that application, and then at least you can make an informed decision about how much financial assistance you qualify for and what those actual costs might look like for you each month. And in addition to some help with the monthly premiums, we also have cost sharing reductions, which is another form of subsidies that are available for folks. And similar to how premium tax credits will lower that monthly payment, cost sharing reductions lower those out-of-pocket costs that you might have to pay, like deductibles, co-pays, co-insurance. And it's really important that folks know that these cost sharing reductions to help with those out-of-pocket costs are only available in our silver level plans. And you'll see here on the slide, the bronze, silver, and gold, and that's referencing the different tiers of plans we have available. And so you can use premium tax credits on any plans, but if you qualify for cost sharing reductions, you have to get a silver plan to be able to use them. And if you're feeling overwhelmed at this point because I'm using a lot of jargon, you are not alone. Just keep hanging with me, and we're going to get to the point where I talk to you about how we can connect you with assisters to make this a little bit easier for folks. I'm not going to spend too much time on this, but this is just a pre-ARPA example of what prices might look like for a 40-year-old in King County with a $1,600 a month income. Some pretty hefty subsidies were already available. And now with the American Rescue Plan Act that passed earlier this year, those subsidies are even more generous, bringing that monthly premium down even further for the majority of our customers. Next slide, please. So where do I sign up? I feel like I've said it many times. I'm going to keep saying it. So it's WA Healthplanfinder.org. I will caution folks, be aware of lookalike sites. This screenshot here is what our website looks like. But, you know, we have had to work with the Attorney General's office over the past couple of years, just because the internet is what it is and people like to be tricky. And so make sure you're going to wahealthplanfinder.org. That is what our website looks like. We also have a mobile app. It's called the WA Plan Finder in the Apple or the Google store. And that's a really helpful tool to use as well. Next slide, please. All right, so I mentioned before that we have some help on our website, some tools to help folks kind of sort through the plans that might be best for them. And we call that tool the Smart Plan Finder. And so with the Smart Plan Finder, when you're on our website, it will prompt you to say, hey, do you want some help shopping for a plan? You'll see this little pop-up right here. And you can say, yes, help me find a plan. You put in the providers you're seeing, you put in any medications that you need covered, and then the Smart Plan Finder will automatically show you what plans cover those providers or cover those medications. And I always tell folks it's a helpful tool, but if you have like a specialist that you really need to see, I always encourage folks to call your doctor's office and just make sure they take the plan that you are looking at selecting. We try really hard to make sure we have all of the updated information, but we always just caution folks, if there's a provider you really, really need in your network, it's worth that extra step to call them just to make sure that they do take that plan. Next slide, please. And if you don't want to spend half an hour on our website for the very first time, filling out all of the information before you even see what plans we have available, no worries. You can just go to wahealthplanfinder.org and quickly browse what plans we have available in your area just by putting in a little bit of information. So if you go to our website, you click the Browse and Compare Plans button there, you just put in your income, you enter your zip code, and then you hit review, and it will show you the plans that are available in your area. I caution you though, this is just going to show you the plans that are available at their full cost. So remember, if you're not going to fill out the full application and you're just going to quickly browse plans, it's not going to include what you personally might qualify for in terms of tax credits or cost sharing reductions to help offset that cost. So if you go look at these plans, just beware of sticker shock and just know that we do have a lot of financial assistance available to help folks right now, but to see what the prices would look like, you do have to fill out the full application. Next slide, please. All right, because I know you're probably feeling overwhelmed. I'm feeling overwhelmed, and I do this all day long, every day. We have a lot of enrollment assistance available statewide to help you. We can do virtual or in-person enrollment assistance, and it's all available at no cost to you. We have a couple different kinds of assisters. We have navigators. They are located in communities across the state. They are enrollment experts, and they can help step you through the application and coach you in figuring out which health plan is best for you. We also work with certified insurance brokers. They are also available across the state, and they can really help with that very specific guidance folks might need. And then we also have 11 enrollment centers across the state, and these are just our brick and mortar storefronts that you might see in your community. And they are staffed by both brokers and navigators, and they are ready to provide that assistance and support. And to connect with any of these individuals, just go to wahealthplanfinder.org and click Get Virtual Help. From there, you can search for a navigator or broker in your community. And I have one more slide, and then I'm going to hand it over to Joan to talk about childcare specific. All right, so coming soon, this past legislative session, Joan is really good at her job, and she worked hard with the legislature and was able to secure some additional resources for us to support the small business sector. And so we're really excited to be bringing on these employees, just hired them. We're in the process of onboarding right now, but we're going to have some dedicated staff to support employees and workers that are transitioning from employer-sponsored coverage or other coverage options, and really working with small business owners seeking to understand how can their employees use the Health Plan Finder to obtain insurance coverage. This is work that we currently do, but during the pandemic, it was just clear that we need more hands on deck to do it to the scale that we would like to. The need is out there. We know that people are going from employer-sponsored insurance. They've never needed to know about the exchange, but now they're in a situation where they do need our services, and they might not know that we exist. And so we want to build out relationships, get the word out about what we do, who we are, do more presentations like this, and then also work one-on-one with small business owners who are trying to understand how can they help their employees use the exchange to get insurance coverage, which I think has just been something that throughout this pandemic has really highlighted the need to make that happen. So if you have questions about those resources or you'd like to take advantage of them, please reach out to me. My email is on this slide, and I'm always happy to connect and answer any questions you might have. And so with that, I'm going to hand it over to Joan, and she's going to talk about our childcare program, which we are excited to launch.
Thanks, Mary. I did see one question in the chat that I'll toss your way, and I'll look for maybe some clarification about which tool. I'm not entirely sure, but there was a question asking about whether it was a good tool for a small not-for-profit community-based organization looking to develop a compensation package as they move from a part-time contractor to an FTE scenario. So I'll go ahead.
I was just going to say, I just encourage you to reach out to me and we can chat about your situation to see what would be most helpful. Joan, I don't know if there's anything you'd want to add in the context of the webinar, but we're always happy to connect and see what we can do to help.
Yeah, I think to Mary's earlier point, we really sincerely want to grow this part of the support we're able to offer to small business. And I think it's a perfect time if you, given the audience for this webinar, if you are sitting here thinking to yourself, how can I sort of better connect my employees to affordable healthcare coverage options in the state? How can I better understand sort of how to compare what I may be offering now, or how might I be able to help my employees get covered, especially in a situation where maybe there's seasonal employment or churn, as the statistics earlier pointed out. We have some really good tools online now that help you understand what options are available and how much they cost. But I also think we are always willing to listen and develop new tools, toolkits, checklists, sort of audience and segment specific materials. That's something we really like to do. So if you work in a business sector, and Lisa, certainly working with you and your association, wanting to further understand if you have ideas about what tools or what resources or what additional information from the exchange would be useful in helping you connect to your health coverage options and understand them. We're all ears, and we really welcome the feedback. And if people on the webinar have ideas they want to put in the chat, we would welcome that. And if you want to connect with Mary afterwards, or if you're listening to this afterwards, we want to hear from you.
And Joan, there's one other question. How long do we think these subsidies will be available? So our tax credits that have always been available, those are ongoing, but the additional ones that were passed this past spring, those go through the end of next year unless Congress decides to extend them, which I know there are efforts to do, but for right now they are available. And so we really just encourage folks, come in and please let us help make your health coverage more affordable. All right, Joan, handing it over to you.
And some folks may have seen currently at the federal level, the Congress is actively working on this 3.5 trillion, billion, gazillion dollar package as a reconciliation package, extension of these, we call them ARPA subsidies. We understand that is being included in the package and is something that will be, that some folks at the federal level are pursuing. So we are waiting with fingers crossed. We're hoping in the next couple of months we'll have some clarity about, potentially these enhanced subsidies on top of our typical subsidies being extended for an even longer period of time. Okay, I'm going to go ahead and get started. There was one more question in the chat, Lisa, and I'll look for your assist here too if we're missing the question, and apologies in advance if we are. Mary and I are learning how to speak business and childcare. We are definitely not all the way there yet. First to admit that, but there is no barrier to any. If you are an employer and you have who needs coverage, or you have employees who need coverage, whatever sector you're in, you are able to use Healthplanfinder. So there's no sort of barrier to entry in using Healthplanfinder based on your sector. We have a whole bunch of different types of sectors and business types who use the exchange. It's a perfect segue though, and come at us, Lisa, again, if we didn't get there. But it's a good segue to this new program. So, at any time for any program, for any sector, we have assisters and a portal and online tools and a willing staff who can engage with you and connect you with navigators and brokers and people who can help you understand your options. That's sort of our everyday, day-to-day work portfolio that we're excited to do and we love doing. This new program was a little bit more of a surprise, and it's a little bit segment specific. So during the 2021 legislative session, some childcare advocates, some interested legislators were interested in how to make more affordable coverage available to childcare employees. I think in recognition of the statistics Lisa shared earlier, that we're just in a really critical time for childcare. We have so many sectors who are dependent on childcare, and we have so many passionate associations and businesses who rely on good childcare being available to themselves and their staff. So in the 2021 legislative session, the legislature appropriated $30 million for a new premium assistance program for employees of licensed childcare facilities. So everything that we are covering in this half of the presentation is really focused on if you are an employer of a licensed childcare facility, or you are an employee of a licensed childcare facility through 2022. There's sort of this time limited option that the legislature is making available to you. It's administered by the Health Benefit Exchange in close partnership with the Department of Children, Youth, and Families, and one of our sister Navigator networks, the Yakima Neighborhood Health Services. So the three of us are working pretty closely together to launch this new program so that we can start getting free healthcare to folks. And when I say free, I mean, Mary mentioned someone coming through Healthplanfinder. You're screened to see if you're eligible for Medicaid or Medicare. You're eligible for your federal tax credit and maybe your enhanced ARPA tax credit, and that gets applied. And then on top of that help, if you have a premium that's left and you are under 300% of the federal poverty level, this program wraps around your other available assistance to bring that premium down to zero. So some folks can come through Healthplanfinder right now and get a $0 premium or a $1 premium anyway, because of the extended federal assistance that's available. If you are a childcare worker and you are qualified for this program, and you will then, if you have any remaining premium after the available help, it will bring it down to zero. So it's a pretty exciting opportunity. We're really excited to be working in partnership with others to bring it to bear. The program has to start by November 1st under the state law. We are doing our darndest to launch before then. So really leaning in with DCYF and Yakima to be ready as soon as we can. We'll let you know, and Lisa will certainly give you information to blast out to your members when we are ready to launch. You can also reach out to Mary and they will put you on the listserv to sort of know more immediately as we sort of share implementation updates and our launch update, and as we sort of get this program up and running. Past, the spring, we're trying to launch it this fall. So doing as best we can to bring it to you as soon as we can. This is another program that has been funded through 2022. And there, I know, will be advocacy and other efforts, particularly if it's effective in bringing in childcare workers and getting them covered, to potentially extend that program as well. But currently the legislature has just funded it through December. So let's talk about how it works and who's eligible. Here's who you need to be able to benefit from this program based on the law that was passed. So first, you have to work in a licensed childcare facility, and this includes family home and center-based and school-aged and outdoor nature-based childcare programs. I did not know that was a thing, but it is. So that's exciting. It's a pretty inclusive definition. And again, if you are someone who works in one of these sectors and you're not sure if you qualify or not, we are encouraging everyone to come through and see if they qualify. You have to meet income and other program requirements. So again, 300% of the federal poverty level, that's just under $40,000 a year for a family of one, and just under $80,000 a year for a family of four. Again, I will say that there are deductions that are available to you from your countable income if you are someone who is self-employed, and there are people who can help step you through our application to see if there are income deductions that you qualify for that would maybe get you under that threshold if you're someone who's sitting just over it, or want to know if you could qualify. We certainly encourage everyone who's in the childcare space or works in a licensed childcare facility to come in and see if they could take advantage of this program. You have to, how it works is you come through Washington Healthplanfinder. Though people who qualify for Washington Apple Health or for Medicare need to go get covered through those programs. It's for people who don't really have one of those coverage options available to them. And you will have whatever federal subsidy that's available to you. It might be a lot, it might be a little. You apply that to your premium, and then this program wraps around the rest to bring your premium down to zero. The program is attached to a specific type of plan, and it's a plan that the assisters in Yakima who will be helping you will flag for you and help you understand. We have a new type of plan that was available in 2021 that a lot of new enrollees selected called the Cascade Care. It's a high quality plan. It offers a standardized benefit package and lower deductibles and more service before the deductible. So it really helps customers manage their out-of-pocket costs. And Mary mentioned we have bronze, silver, and gold products. This program is specific to silver plans. So if you, when we launch the program and you connect with Yakima, if you are someone who's eligible to purchase a qualified health plan and you're eligible for this program, then the navigators will let you know which plans there are that qualify. Every single carrier that participates in the exchange offers a Cascade Care Silver plan. So you have a wide choice of carriers, and there's one where you can figure out if your doctor's in network that's in your area. We're confident there's a choice there for everyone. It doesn't limit your choice of carrier. It just limits your metal tier. I'm going to move into some Q&As. And again, as folks think of questions that we don't cover here, feel free to reach out and let us know. One question we received quite often: what about my admin? What about my part-time employees? What about my sort of the other non-caregiving employees that I have? Are they eligible? Yes, you're all eligible. Any employee of a licensed childcare facility is eligible if they meet the other program requirements I just mentioned. The Washington State Department of Children and Families is going to identify for us employees of licensed childcare facilities. That is not information we have. It is never information we would pretend to understand. So DCYF will be telling us who is eligible. DCYF will be pushing information out to people who are eligible. So if you are someone listening to this webinar, participating today, and you are thinking, am I on this list? Do I qualify? You will know, because two things will happen. DCYF will tell you that you are eligible, and then Yakima Neighborhood Health Services will also reach out to you proactively if you are eligible. So you will get an email from DCYF that says, congrats, it looks like you're a licensed childcare provider. You should call Yakima and see if you're eligible. You'll call Yakima and go through that whole process. If Yakima never hears from you, they will contact you. They'll say, you're a licensed childcare provider. Do you want to see if you're eligible for this program? You will say yes. And then they will work with you to see if you are eligible. And if you're eligible, we'll sign you up for care and get you that $0 premium. Another common question: are family members also eligible for coverage for this program? Sadly, no. Right now, the program is only for employees of licensed childcare facilities. However, your family members may be eligible for the other affordability programs we mentioned, and Yakima is willing and able to help all of you. So whether you or your family member need coverage, we can help you both. We can help your entire family. We do have one family of 21 people in the exchange. So you and however many family members you have, we want to hear from you. We want to help you all get covered, and we can. Final sort of question here: what if an employee leaves employment? Lisa, you had a really good churn statistic at the beginning. I think the legislature understood there was a lot of churn and turnover in this population. They made this program available to people for the remainder of the year. So if you come in, let's say in October, and you are found eligible for this program, and then you lose your job a month later, you are still in the program. You don't need to keep coming in and re-signing up as you switch from employer to employer. You're in for the duration of the plan year. If you come in for 2022, you're in for the duration of 2022. So we're hoping to make it as easy for people as possible. I just have a few seconds left, so I'll just sort of breeze through here for the last couple slides. We get a lot of questions about what types of benefits do your plans cover. So this is a slide that tells you a little bit about that. All of our plans cover a core set of essential health benefits. Some of them include vision. That's a common question we get. Dental is offered as a standalone product. You can also buy that product in the exchange. It's about $15, $20 usually for the dental plans we have in the exchange, but that's not covered under this program. This is a little bit more on how the program works, which I mentioned. DCYF will email you. You will call or email the trained assisters at Yakima. They will help everyone in the state. They'll help everyone in your family. You need to go through them. They need to open up a special enrollment period to let you through the door, since we're outside of open enrollment. So everyone sort of funnels through Yakima. And then once you're in and enrolled, we make payments out of that $30 million pot the legislature gave us to pay your premiums to your health carrier. So as you sign up, if we launch in November, when your coverage starts depends on when you sign up. So if we launch November 1st and you sign up on November 2nd, your coverage will start December 1st. There's sort of a normal cadence. It's sort of, we follow the 15th of the month. So when your coverage starts, it's sort of up to you and how quickly you act to get covered. So that's it for me. I'm sorry I went a minute over, Lisa. I was trying to do it, but I didn't want to talk super fast. So that's sort of the spiel from me on the new program. Certainly welcome people's comments and questions, and we're really excited to bring it to folks. We're really excited for help getting into the childcare space. So if you are on this call and on the webinar and interested, definitely let us know, and you'll be hearing from DCYF as soon as we launch, which will hopefully be sooner rather than later. So thanks.
Excellent. Excellent. Both Joan and Mary, thank you for taking the time to unpack all of this material. It's incredibly complex, but also simple in a lot of respects. What we know is that having a small childcare center or a home-based childcare center is really difficult. It's hard to be profitable, it's hard to manage costs, it's hard to keep employees, it's hard to do a lot of things. And that's why our partners with WSMA, Washington State Microenterprise Association, are there. They're there all over the state. You can go to our website. Maybe Sheree can put the website in the chat. And they walk people through the process of writing a business plan and managing costs and understanding cash flow. And we have María Rodríguez from Yakima, and we're very excited to have you here, María. I know that you are in transit, so you're by phone. But if you would share a little bit of your experience on the ground working with childcare centers and how the role or the import of healthcare and why healthcare coverage is such an essential piece of that business development strategy. And I think you need to unmute. And I hope you can hear me. Okay, there you are.
There you go. Hi, Lisa. Hi, everybody.
Hey, good morning, afternoon.
Afternoon.
Yes, good afternoon. So did you hear my question?
Not really. Can you repeat that again? I was actually in a tunnel.
No problem. No problem. We just had this excellent presentation by Mary and Joan from the Health Benefit Exchange. And we wanted your perspective as a microenterprise development organization working with childcare providers and just the role health coverage has in the running of a childcare business and how important it is to maintain or have healthcare coverage to keep your employees and how that impacts the cost of running a childcare. You've worked with so many on the ground. Just your perspective about this.
Yeah, of course. Well, a little background. Our CDR started 30 years ago, providing technical assistance and access to capital for small businesses getting started, the unbankable, the low-income community and entrepreneurs. Through that, we've grown the Center for Latino Farmers program, which is now 20 years old, similarly providing assistance to farm workers becoming farm owners. Hopefully you can hear me. I'm going through another tunnel, but
you're doing great.
But ultimately, our services are offered to any entrepreneur of any color, any size, anything that they want to do. We try to make it a reality for them to provide for their families. Ultimately, that's what we are here for and have continued to do. Child care centers has always been one of the most popular startup businesses that we get. They start primarily at home with about 6 or 8 children, eventually going to 12. We've gotten some bigger entrepreneurs that have actual childcare centers here in Yakima, Mattawa, the whole valley, the whole central Washington, our service area. But what we've seen, not only with childcare providers, but with all entrepreneurs and small business owners, is the lack of resources or funding or affordability to provide medical benefits to their employees or to themselves. if at all. Many times they go without it. Well, they can't afford it. Well, they can't do that. There's always something or another. There's other priorities. And ultimately, with the pandemic, we've all suffered tremendously. And that continues to be something that isn't thought about often enough, even though we mention it, we recommend it, we try to find the resources. But it's always that difficulty that, well, how much is it going to cost me? How much is it going to cost the employee? As it is, minimum wage doesn't go very far anymore. The cost of living is tremendously high all over the state. And in Yakima, that our service area doesn't get any better. So we're having 2-3 jobs for many family members, and they still can't make ends meet. So what we're trying to do, not only do we help them with the technical assistance, the business plan development, but the access to financing, that is the crucial part to get them started. I actually, as a matter of fact, I'm helping a client just yesterday. Again, she's reopening her childcare center because through the pandemic, she had to close. She was unable to afford it. So she's starting back up again, and we helped her back in 2003 when she first opened. So you see this transition and this, you see it all, what they've suffered, what they go through, how much they're able to grow, and then all of a sudden it's all taken away from them. And we're trying to bring that back. What other resources can we offer? And if there's a way that we can help them keep their employees, because there's a lack of employees across the state, not just for childcare, for farm workers, for everybody really, how can we provide that? Who do we need to contact? And I briefly heard the previous presentation before me, Lisa. So I think that's something that needs to be discussed a little bit further and build that relationship and that partnership. I heard Yakima quite a bit in the neighborhood clinic and all, but who are they really reaching out to? Many times they don't reach out to those that need it, and so many fall through the cracks, and they continue to fall, and we try to pick up those that do, but many times we don't have that outlet or that other resource or that partner that we can say, hey, I have so and so, how can we help them? What do we need to do? Because they don't have time. They're there to take care of their business. The administration is it takes a lot of time, and that's one of the things that they least like to do, and that's across the board on all entrepreneurs.
That is so right. Maria, thank you. That has been a consistent message. And I think what we're hearing today from Joan and Mary is that there are these resources available, and that there's a place you can send these childcare providers to access the healthcare coverage, because the legislature passed this new funding appropriation for $30 million for new premium assistance for childcare employees, both those direct childcare providers, but also the accountant or the other employees within that childcare center. So my hope, Maria, is that you and all the other participants that hear this webinar in the future, is you get the word out about this program, so that come November 1st, we have as many possible childcare providers out there signed up, their employees are signed up, and healthcare coverage is coming to the people who really make the least amount of money, do one of the most important jobs in the world at caring for our children, and more importantly, providing very high quality care for these kids so their parents can get to work.
Yes. One other thing that I like to mention, as we know, a lot of our clientele tends to be undocumented, and that's always a fear. Is this any different than the Washington Healthplanfinder and those benefits that they have to have legal status to be able to qualify for any of it? Because that's going to be a big question that I'm going to get asked. And if I don't have the resources, again, they're going back to not getting the service at all.
Sure. Yeah. Hey, Maria, this is Joan and from the exchange, and Lisa, I can jump in and answer that if that would be helpful.
That'd be great. Thank you.
Sure. So under federal law, there are certain programs that people who are currently undocumented are not eligible for. However, at the state level, there are programs that are available today that will continue to be available tomorrow to people regardless of their immigration status. So today, if you're someone who's undocumented, there are certain Washington Apple Health programs that you are eligible for. There's certain emergency services, there's certain pregnancy services, and particularly if you are someone, your children people up to age 19, there are certain programs that there's eligibility for. The legislature, in part of what they did last year, was task the exchange in working with partners at the Healthcare Authority and the Office Insurance Commissioner to figure out what a broader state program, state solution could be, and what a broader coverage solution could be to reaching people without a federally qualifying immigration status. So that is something that we are working on for future years. At present, if you come through Healthplanfinder and there is not an eligible Washington Apple Health program you're eligible for, under federal law, we can't put you in a qualified health plan. Again, so something we're working on, but wouldn't be eligible for this childcare program today.
Thank you.
Thank you, Maria. And I guess I have a couple of questions too. I know that you didn't have a lot of time, Maria. I know you're going into another meeting, but when you think about the child care providers in the Yakima area, or in that, I mean, I think you serve the 10 central counties in the state with microlending services and training support. Do you feel like getting this information to them is possible? Do you think they'll access it? Is there anything that either Joan or Mary, the Health Exchange, can do to better reach and serve these child care providers in these remote rural communities?
Most definitely. I think it has to do with what we're doing. Lisa's MDOs, we're down on the ground. We're at the ground level, strapping up our boots and doing the outreach, the dirty work that nobody wants to do. But I think piggybacking off a training that we're already doing, or scheduling something at that in these more remote areas with the exchange, because I can only give them so much information. It's very limited. But if we have them present, I think that helps them understand and see the person behind it and ask those questions that many times they won't ask in a call like this, or a different type of Zoom meeting. But when you have them in a more comfortable setting, they're more likely to ask the hard questions and take advantage of the resources and ultimately apply.
And Maria, this is Mary. I appreciate you saying that. And you can bet I'm going to get your contact information. I'm going to reach out to you because we'd love to connect with you and see how else we can partner in reaching folks.
Yeah, that'd be great.
So I had one more question. And Maria, just help me through this. When you had mentioned, and we have seen with other MDOs around the state or microenterprise development organizations, that serving historically marginalized entrepreneurs is harder, and it takes more time, and there's a lot more hand-holding. But once they have the technical assistance and the training and the microloans, they're just more able to grow and become sturdy and profitable. And so I guess what I'm curious is, when you think about healthcare as a percentage or a portion of those costs as a small business owner, how can we more effectively provide this kind of support tailored for childcare centers in rural communities? I know you said we can have webinars and conversations, but really getting down to the cash flow or the business logistics of managing healthcare costs for a small childcare center is really critical. I'm just curious about your insight on that.
Well, definitely, it does take a lot more hand-holding, Lisa, but having the in-person touch, the high-touch meetings and continued trainings and more meetings and more paperwork, but really bringing that into a financial training. We do some training, however, it's always, they're on a whim, what needs to get paid first. And really having them repeat the training and budgeting would be one section where they can budget a medical expense for their employees. It's hard enough as an MDO to provide those services for our employees as it is. It's that much harder for a small business owner to do that and actually say, well, instead of paying for this, I can be buying more inventory, or I can be buying more supplies, things that they really need for their business. This, they don't see it as important. They know it is. However, it's hard to, because they don't project it. They don't budget for it. So, but really having that conversation, the importance of keeping their employees, well, this is one option. You have to budget out there. What can we reduce an expense? Perhaps you do something else, reduce the advertisement or whatever it is. But it does go back to really organizing their financials and their plan and what it is that their business is all about to determine when and how we're going to input the medical expense for their employees.
Yeah, that is super helpful. And so one thing that we will do, based on your recommendation, Maria, and you, Joan, and Mary, is offer up or suggest that our MDOs around the state just include this as a component of their business planning programs, so that it's not just going to the MDO or the Microenterprise Development Organization, but they're integrating it into their business coaching, their technical assistance, and their training programs. And so that's a really excellent suggestion. I don't know if there were any other questions from the chat. I know that we're at about 3 o'clock. Are there any questions before we end? It's good to see your face. So I would like then very much to say thank you. And thank you to you, Mary and Joan, for presenting this incredibly valuable material. Thank you, Maria, for taking the time in transit to come to this program and share the perspective of a business training provider on the ground. And we will have this webinar put together in a link on our website. You'll be able to watch the webinar. You'll see the questions in the chat and a summary of the links that come out of here. We'll also add additional links. I know the Department of Commerce has an excellent team of folks who are working with childcare providers on best practice around the state. And we'll ensure to include those links as well. Thank you, all of you, for your time. And I hope I'm not missing anything. Thank you to our panelists. Thank you to our attendees. We look forward to learning more here, and have a wonderful afternoon.
Thank you,
Thanks so much for having us, Lisa.
You bet. Take care.